Thank you very much, Tamara, and good evening. Thank all of you for joining us. I'm Helen Giddings. I chair the Women's Leadership Summit, WLS. I'm privileged to chair a committee of an incredible group of women. They are thought leaders and their influences. And I'd like to acknowledge them on the slide that you're going to see. I'd also like to thank Tamara Sadler, our coordinator, and Queen Cora Coleman, an incredible woman who has volunteered her time to help make this evening possible. Queen Cora is a talented musician who backed Prince and Beyonce on drums in their Super Bowl appearances. As many of you know, our summit was scheduled for this weekend, and because of coronavirus, it has been postponed until April 9th and 10th of 2021. Now, why are we here? Well, since we had to postpone the conference, this is the first in our new virtual series called Let's Talk. This evening's seminar or webinar is Let's Talk Mental Health. About 3 weeks ago, actually it was before the death of George Floyd, WLS recognized the tremendous pain, the suffering of this coronavirus. Some of us felt disconnected. Some of us were anxious. Some of us were lonely and isolated. Some of us were frightened. We were, in fact, in unprecedented times. We were aware of the disproportionate impact of coronavirus on Blacks. Blacks are 13.4% of the population, but yet we are more than 3 times that percentage in terms of people who have lost their lives. We have so many questions, and we have very few answers. So we decided to talk. Let's talk. Let's talk about our pain. Let's talk about the trauma. Let's talk about how we talk to our children. Let's talk about our physical health. Let's talk about our mental health. Let's talk about this challenging season. Let's talk about coronavirus. Let's talk about Ahmaud Arbery, Breonna Taylor. Let's talk about George Floyd. To lead the discussion today, we have Dr. Donna Ellen Newsome. Dr. Newsome is a neurologist. She is both an MD and a PhD. And I asked Donna how she got into this field. And she told me the story of her grandfather, who was the kind of Baptist minister that many of us know well, the kind who gets up and shouts and hollers and run around the pulpit. And then, unfortunately, her grandfather experienced bleeding from the brain. And he couldn't do those things anymore. And he just wanted someone to fix him. He bought Donna a piano when she was only 5 years old. She still has that piano today. And Donna grew up just wanting to fix people who had something wrong with their brain, like her grandfather. So I am pleased to have the opportunity to introduce to you this evening Dr. Donna Newsome, who is going to narrate our panel this evening. Dr. Newsome.
Good evening. Good evening. Donna Ellen Newsome. I'm a hospital neurologist and a committee member on the WLS team. I have the pleasure of introducing the 3 W's of our webinar. That's right, witty, wonderful women. They're Doctors Wall, Waggoner, and Wiggins, each more than qualified in their respective fields. As stated, they will address how today's events affects our mental and physical health and lay out the best options so we can survive through these trying times. So let's talk about our 3 W's. We have 3 panelists. The first being Dr. Brenda Wall, who's a psychologist. She served in this area for 3 decades, and she experience includes working in clinical psychology, which involves broad exposure in psychotherapy and assessment. She's been vice president of Bishop College and Texas College, and also department chair at Grambling State University. She addresses issues of ageism, racial and cultural trauma, religious prejudice and intolerance, as well as implicit bias based on perceived status. Dr. Wall has been a Fulbright scholar and serves currently as pastor of counseling at Friendship West Baptist Church. Dr. Wall will discuss where we are now and its effects on mental health. Our second panelist is Dr. Jill Waggoner. Dr. Waggoner has certification in both preventative medicine and wellness coordination. She is a board-certified family practice physician with more than 25 years of experience. She has studied functional and integrative medicine for the past 15 years, which is an approach that seeks to find the cause of disease and uses multiple healing modalities to help patients obtain optimal health. Her teachings to her patients help them flourish and embrace better living through better health. Dr. Waggoner has authored 7 books. The most recent, Sex, Mind, Body, and Spirit, which begins on ongoing dialogue about sexuality and its impact on balanced life. She's also a national medical expert and has been selected in our own D magazine for Best Doctor 3 consecutive years. Dr. Waggoner will discuss the philosophy of mental health and how it has evolved over the years and what we can do today. And our last wonderful panelist is Dr. Paula Donns-Wiggins. Dr. Wiggins is a board-certified psychiatrist and adjunct professor at the practice of pastoral care at Perkins School of Theology right here at Southern Methodist University. She has worked to increase dialogue and collaboration between mental health and religious professionals to promote a greater understanding of mental illness and decrease the stigma that often results in people not availing themselves of effective treatment. She earned her bachelor's degrees in biology at Harvard, as well as a medical degree at Harvard Medical School. She's a member of St. Luke Community and serves as the coordinator of the mental health ministry and directress of the Angel and Cherub Choir. She currently serves as chairperson of the Board of Managers of Parkland Health and Hospital. Dr. Wiggins is a clinician and will give her viewpoint on today's world regarding diagnosis and treatment. Those are our 3 wonderful women discussing at our webinar. Ladies, Dr. Wall.
Dr. Newsome, thank you so much. You're such a beautiful and brilliant woman. I've got to thank all of you for making this possible. And as you've introduced my fellow panelists, my sisters, you can see that truly I'm among geniuses. And I know, that they are indeed geniuses. I love them. But let's talk mental health. Let's talk mental health. This is a tough day for us. It's a tough day. This is the day that George Floyd has been laid to rest. Many of us may have seen some of the homegoing services, but certainly all of us understand what has happened. All of us have seen the video. We were forced to see a lynching. We were forced to see someone die before our very eyes. And that's trauma. That's great trauma. But the mothers have been holding it strong. They have been holding it down. And so even today, we saw so many mothers who came out to support and love the family. We saw the mother of Ahmaud Arbery, who was with the family. We saw the mother of Eric Garner. We saw so many of the mothers who have been through so much. Our mothers have borne so much trauma. Eric Garner, Michael Brown. We can just rattle off the names. Walter Scott, Tamir Rice, Philando Castile. He lived in the sister city of Minneapolis. He was from St. Paul. And we saw so many die before our eyes. And yet, with unarmed men being slain by armed police officers, the cries have gone up for justice, but the trauma has been real. From the trauma of Mamie Till Mobley, who said, you know what, we're going to have an open casket. You're going to see my son. You're going to see what happens in the United States of America. And that launch, some 55, it was in 1955, that launch allowed us to move into the civil rights arena. But so much trauma. And you would think that would be enough. The protest, the resistance, you would think that would be enough. But the COVID-19, we heard that from our sister Helen Giddings, who said, it's in our community, it's here. The whole world was sat down and instituted yet another form of trauma. What are we going to do? How safe are we? What's going to happen with our children? Schools closed, businesses plummeted. We had a financial reversal on top of that. They tell us we're in the midst of a recession. You may know that if you look at your 401k. You may know that if you look at your bank account. So much stress and trauma. And you would think that that would be enough, but there's always more. There's always another layer of what's happening in family. People say to me, well, you know, why don't more people go for mental health counseling? Why don't we have more counseling in our community? And I say, well, now, you know, part of what we need to understand is a little of the history of mental health and what has happened historically. We have never known in the United States of America, we have never known one day of justice. If we go back to 1619 and the trauma of being enslaved, we know that there is indeed a lot of pressure that our ancestors have endured. We even had enslavement before that. We came almost 100 years before 1619. A lot of us haven't looked at that. It's coming out as we understand how we have gone through so much. But if you ran away from slavery, everybody, they said you were mentally ill. If you fled to freedom, they said, oh, you got drapetomania. Now, people did say that was a pseudoscience and it wasn't a true diagnosis, but you can see that from the very beginning, people tried to make, white supremacists tried to make us see ourselves as mentally deficient and emotionally unstable. So if you know that is the pressure that is before you, you're not necessarily going to turn to that source as an agency of healing. And so our people turn to one another. We turn to our ancestors. We turn to our family members. We turn to our God. We turn to some other ways of enduring. But people say, well, yeah, you know, but Dr. Wall, you're a psychologist. Why are you a psychologist? And I say, it's a young science. Hasn't been around that long. And there haven't been that many African Americans who were schooled in psychology or psychiatry. So if you go back to, let's go back to 1954, and you look at Dr. Kenneth Clark or Dr. Mamie Clark, his wife. Those were the two psychologists who made it possible for us to understand separate is not equal. And because of the work that they did, we were able to have the 1954 Supreme Court decision. And that began to help us understand that we could move into professional psychology, and there could be some places where we could speak to one another. One of my favorite books that was written was Even the Rat Was White. Because if you look at the research, even when I came along about a half century ago, that the research, the work that we did, the standardization, it was on white community. We did not have standards based on ourselves. So we were psychologists who were entering a profession and redefining the narrative. And the narrative did change in such a way where we were able to look at, okay, we can do some work for ourselves. But it wasn't until after the death of Martin Luther King that we began to have professional associations that truly did address the needs of our people. We had the Association of Black Psychologists that came up in 1968, and so did the National Association of Black Social Workers. So this is when the profession began to shift, and this is when we began to have people who were trained so they could help us look at the condition that we experience today. Even the concept of trauma has been redefined probably in our lifetime, so we understand we deserve to be mentally healthy. We deserve to be solid women and men. We deserve to know that we don't have to live with anxiety. We don't have to live with depression. We can challenge the diagnoses of schizophrenia and bipolar and make sure that they're an adequate fit. We need to know that there's some things that we can do. But you know, when I talk about all of this and when I look at the history, you know, I feel like I need some mental health. So I think I'm going to turn to Dr. Jill Waggoner. Dr. Jill Waggoner speaks of mental health.
You know, I am a primary care doctor, and often I have people come in and say, Dr. Jill, I need some mental health. First of all, let me say I'm so excited to be with you all. We have for years, all of us, shared patients and worked collectively trying to keep people well in our communities. So it is an absolute honor and pleasure to be on here with all of you all. I think that it's really important, and all of the history was just amazing. Thank you so much, Dr. Wall. But I think it's really important for us to say, as you said, Dr. Jill, I need some mental health. In primary care medicine, a lot of times people present to us and they come to us because they are experiencing some mental illness or some anxiety or depression or some of that, and really don't know where to go, or are afraid of psychiatry or psychology, which is really interesting, particularly among many people who are Christian or religious, because they feel if they turn for help, that means they're not praying hard enough. So I often have people come into my office and they are in complete distress, not knowing where to go. So as a primary care doctor, we're kind of on the front lines in terms of mental health and many other things. And I often will say to patients, let's start you on some medicine if you need that to get through this, but let's get you some counseling as well. And they will say to me, you know, Dr. Jill, I don't want to, you're my counselor. And so I have to tell them, no, I am not. That is not my profession. I am here to help you with your complete state of wellness, but you need a specialist for that, just like you need a specialist for your heart. And so just to have this conversation is an amazing thing. But let me tell you why I think this particular moment in history is so important for us in terms of mental health. One of the things that we have done in medicine is we have isolated everything. So we've separated everything. We've separated symptoms from cause. We've separated cause from effect. We treat somebody's high blood pressure, we treat their diabetes, we treat their depression, we treat their anxiety, and we act as though they're all separate things. When the reality is they are all part of one thing. And so initially, all of us were taught that you kind of pick one thing, you treat that one thing, and you don't really think about the cause and effect of it. What is happening right now, we are looking at several public health crises. We are looking at a pandemic. We are looking at injustice. All of that's public health. And I think we have a unique opportunity in changing the dialogue so that we can make a paradigm shift, which is what we are seeing and what people are trying to have happen. When we talk about healthcare in this country, we talk about just that, healthcare. We don't talk about health. We don't talk about wellness. We spend our dollars on healthcare, which is important. But the actual data shows that only about 6% of your entire wellness has to do with care. Most of your wellness has to do with so many other things. It has to do with whether or not you live in a safe community. It has to do with whether or not you have access to healthy food. It has to do with whether or not you had an opportunity to get a good education. It has to do with whether or not you live in a polluted area. It has to do with whether or not you are frightened and scared to death every time you walk out your door, or your son or daughter walks out their door, you're afraid that they're going to be murdered by either somebody who's gangbanging on the street or the police who are killing them. So all of those things have to do with our health, and they really have to do with our mental health. The data indicates that people who come from lower income families have more mental health issues. The data indicates that people who have undergone traumas have more mental health issues. The data indicates that people who live in oppressed areas like us, we are in America and have been under a systemic oppression for hundreds of years, have more mental health issues. And we also know that people who have more mental health issues have more physical issues. So they have more diabetes and they have more heart disease. And so I think one of the biggest things that we have to say is all of it is the same. And so you have to worry about it all. We may not be able to make a change and shift it all at once, but if we can shift the language from the blame of individuals to looking at it as a whole systemic and societal issue, then we will stop blaming people for being depressed, or blaming people for having diabetes, or blaming people for having heart disease. We will say to them, we understand we need to change this system so that we can take away those things that are contributing to your overall illness.
Yeah.
And so, Dr. Paula Donns-Wiggins.
Yes.
Who I also sent many people to. I'm on the phone. Paula, Brenda, can you help me with this one? You tell us what you think we need to focus on in this time.
Well, I'm again so delighted to be in the company of two of the people that I admire the most in the medical community, and you have spoken so well to what I see on a daily basis. I am a psychiatrist, a mental health professional, so ultimately some people do make it to my door, and I would say in the midst of this current circumstance, people are banging on my door, and things are so very busy because, as you all have pointed out, these are very traumatic circumstances. And certainly in the midst of everything that is going on, certainly persons who live daily with the challenges of mental health conditions are experiencing an exacerbation of symptoms with more anxiety and more dysphoria and more confusion and difficulty focusing. But really everybody is.
Right.
And it's understandable because, as has been described, these are traumatic circumstances. And it is a rapid progression of repeated trauma. Every time you turn on the news, that's a traumatizing experience that you see over and over and over again, the victimization of people, many of whom look just like us, and the indifference of not only individuals on the street, but individuals in leadership and in power in our country. And it does have an impact. Understandably, it has an impact. And, you know, and because of that, many people find themselves just feeling overwhelmed. You know, what am I going to do with this? The inputs are so great. I sometimes just feel paralyzed, I often hear people say, as I try to wrap my head around how I feel about the pandemic and my exposure and the risk to my family, to my children, to everyone I'm working with, as I think about the economic impact that I'm experiencing on my family. And for many, it's the first time they have ever been this close to the edge of, you know, just not knowing, do I have the wherewithal to put everything together? And then certainly, I hear it both in terms of the pain and the sorrow of the realization that we've come so far, but we haven't come far at all with regard to issues of race and bias and deeply seated, even though often blinded, hatred of other, and recognizing it when it's overt, as in the horrible death that we've been faced with, but then also realizing all those microaggressions that all of us are experiencing on a day-to-day basis. And suddenly it's almost as if, as we have witnessed the tragedy of George Floyd, it has suddenly turned on a light to the microaggressions that are in every part of our society and are constantly there. But, you know, once people do come to the office and we're engaged and we're talking about that and trying to give language to how to express the impact of these kinds of issues, I often speak to my patients in terms of the model that is used in the practice of psychiatry to understand symptoms and treatments, which is to say that we experience these things in a biopsychosocial cultural way. Big word, but really just speaks to the various aspects of the impact of trauma on us and the kinds of things we have to do about it. Biologically speaking, you know, we talk a great deal about these chemical imbalances, and you know, now in the last 20 years, you're seeing commercials about them, and we know that when you are constantly under stress, there are things that happen with serotonin and norepinephrine and cortisol in different parts of the brain, and many of the medications that can be helpful when symptoms are severe are targeted toward balancing those neurochemicals in the brain. And certainly there is a place for that. But as you have said, Dr. Jill, I mean, it's so much more than that. You know, so I always talk with my patients about diet and having a healthy diet and the impact of a healthy diet on those very neurotransmitters that we talk about. The importance of exercise. These are biological issues. We know that regular aerobic exercise, and recent studies have shown the practice of yoga actually changes brain chemistry.
Yes.
And almost as much in certain situations as the medications that we give. And certainly when in conjunction with medications make a huge, huge, huge difference. Getting adequate sleep. In the midst of all of that's going on, many people find themselves obsessing and talking and worrying and not getting adequate rest. And that too can impact the degree to which you experience anxiety and depression. You have to know how to shut it off for a while and allow your body to rest adequately and deeply enough that your body is going through restoration when you're in deeper levels of sleep. Catnapping doesn't get to that. You have to have enough prolonged sleep. And these are all biological interventions that can make a difference in how you feel and how well you can process and work your way through circumstances. Psychological, well, you know, one of the things that we noticed right away when we had to go through the shutdown for COVID-19 is that it was impacting people in different ways depending on their underlying temperament. You know, persons who are more introverted, to just speak to it in easy, simple terms, were pretty comfortable. They kind of like this idea of being able to work from home and to process and not have the interference of other people in their space, and you know, more time to reflect and to be with themselves, not by themselves, with themselves, and found that very constructive.
Yes.
Persons who are more extroverted often found themselves getting quite anxious. It's a little too quiet here, you know, and you know, I can't function. I'm on edge all the time, and just even that experience is often providing just a bit of insight into deeper reflective work that can be done. What is it that makes me uncomfortable when I'm alone and not with other people around, or why do I need to have so much activity? Is there something perhaps that I am avoiding reflecting on or looking at by being busy all the time? And I just had to star that for a second, because busyness is often a symptom of something unresolved inside. You know, there are sometimes we, particularly as African American women, will program ourselves in ways that we are so busy. We're running from place to place and thing to thing, and we complain / brag about it. You know, we'll be talking with our friends and we'll be listing all the things we had to do as a patients, and I had to go shopping, and it sounds like a complaint, but it's almost as if we have convinced ourselves that increases our worth and value because we're so busy. And the truth is, we're just so stressed, and there's an impact.
I kind of nailed it on the head with that, about us overextending ourselves, especially during this time where we are the sort of the leaders of our household. And any of y'all can answer this question, as you know, the women of our households. And we discussed how mental health can really affect your physical health. How much can that mental health stress really hurt your physical health? And how is it affecting everyone in your household, your kids, your grandkids? What can we do? What tools can we do starting tomorrow? Hey, let's try to help us so we can get on to the next day during these very trying times.
I'll just start briefly. I think that because I have a house full of people, so I don't know about other folk, but I have a house full of people. We have my husband's mom who is disabled is with us. I have 2 daughters who are adults, and but young adults, and then I have boyfriends who come through because the daughters have boyfriends. And they're really nice young men. But we're always really busy in our home, and there's a lot going on. And I think one of the things that I find for myself is to be able to take moments of solitude. So even though you're at home and you were social distancing and not doing the other things, I think as women, we often, if you're at home, oh Lord, you find so much stuff to do. You see things in the corner that you hadn't seen, even noticed, because you'd been passing through so quickly, but now and you think, okay, let me add this to my list. And before you know it, you have a whole list of activities to do during your downtime. So for me, I think it's very important, and important, I recommend this to patients as well, to have a place in your home that is a quiet, sacred space. And you have to have a place, and explain to other people, even if you have little children, to say, when mommy is here, do not bother me. If somebody has died, they will be dead when mommy comes out of here. So it is okay. So, I mean, it's the truth. It's not much I can do that I can't do in 3 or 4 minutes unless it's a real crisis. And so you have to try to help other people understand that you need your moments. And we have to take short moments. If you can't take an hour, make it 30 minutes. If you don't have 30 minutes, make it 10. But it's your 10 minutes to sit and breathe, do whatever you want to do, force yourself to put things down and try to get your brain to shut off. So for me, just taking time, and I recommend that to people, having a spot where you can take time to just be.
Dr. Jill, I think that's excellent. I think that's tremendous. I think what we have to say to high functioning women, such as the women who are joining us on this webinar, we have to encourage them not just to take time for themselves and to do yoga, and those things are so important, but it's very important to set boundaries so that you have a philosophy of no. And very often we refuse to use the word no because we think that it will produce some guilt or some, no. It's all right to say no. It's all right to say no to a child. It's all right to say no to a boss who's calling you online at 11 o'clock at night. It's all right. It's important for you to have the kind of boundaries. And then if you do have a little anxiety or a little guilt then that's something that you can process. But to be able to say no, high women, you got to be able to recognize that you can do it all, and you can, but it will wear you out.
Yes.
Yeah. I certainly want to echo that as well. And I'm still sitting in my office. I was seeing patients, and I don't know if you can see this little thing that I have. When I have patients that are afraid of saying no, this is a ink pen I found in a novelty store somewhere, and it has a little megaphone on it, and when you push it, it and at one point I bought a case of them and had to hand them out.
I want one.
I know, right?
I want one.
Yes. It is so very important, having a sense of boundaries. And really what it speaks to too is just the whole issue of self-care. Because if you're not setting boundaries and taking care of yourself, you will soon be so depleted you can't take care of anybody. And everything will start to fall apart and begin to fall off. So I echo that as well.
You made us laugh. And I think that's another way of self-care, that we really have to not take everything so seriously, because there's so much serious stuff going on every day. We got to laugh. And sometimes that laughter really does take us to a different place. We need to have a sense of not taking everything so profoundly, and being able to just laugh, sometimes laugh at ourselves. Oh, I can't believe I did that. Laughter does have a stress reduction quality to it.
Yes, yes.
Just a little program note for those who are watching. If you have a question, please, there's a little icon on your Zoom for question or Q&A, and just throw your question in there, because I'll ask some questions, but we want to hear from the audience as well. So just to go on a little further, we've found that period of time in our home where we can have 10, oh man, I'll be lucky if I get 10 minutes just to myself, sometimes 30. And typically, which means I have to lock my bedroom door or my bathroom door to say, give me 30 minutes. But then after that, you've got your child or your spouse or the puppy, whatever. How can you help them get through this too? Because they've been in the house, they see the news, they're freaking out.
You become their therapist. So part of what happens when you're in a good place, when you're centered, you're able to do the things for them that you have done for yourself. So you're able to encourage them. You're able to help them structure time. You're able to help them become autonomous when they need to be independent. You're able to help them become closer when they need to be more affectionate. But part of what you get to do when you're centered, when you're in an okay place, you really can begin to mold them so that you understand why somebody might have a meltdown because they've been in the house for 7 or 8 weeks, that you can begin to let them know that they're doing something marvelous and wonderful. For younger children, you can give them activities. For older children, you can give them responsibilities. For grown people, you can help them understand. For adults, you can help them look at that, yeah, you understand where it can be difficult. But we do have ways of connecting. Look at what we're doing now. We do have phone, we do have social media. So I think we can be very aware of the stresses that come from other people and how we can help them address it.
I think, Dr. Wall, that's a really important thing that you said. We kind of help them. We become their counselor in a way. I said I have young adults, and one of my children, I noticed was really distressed. And so just listening to her tell me what was going on. And it was a really interesting thing she was feeling. It was guilt because she was not out there protesting. Because she has many friends who are, but she doesn't, she's not the kind of person to go out and protest, which is not a feeling that I anticipated that she would have. So I'm more thinking she's just concerned about what's going on, and it was guilt that she was feeling. It's amazing how women at whatever age can figure out a way to feel guilty. We can work our way into guilt. Yeah. About and they probably learned that from their mothers, but but just listening to them and helping them pinpoint, or just giving them an ear, so that they will have some place to verbalize the things that they're feeling as well. And I think that's real important with the spouse also.
I was going to swing in the other direction and say that there's some people who are sheltering alone. So you have a lot of individuals, a lot of singles, and if you're introverted, like Dr. Paula Donns-Wiggins says, oh, this is not so bad. But if you're extroverted, oh my gosh, what am I going to do? I've read 10 books already. That it can be difficult for people when they're sheltering by themselves. They may have trouble sleeping. They may have trouble, again, with guilt. Maybe I should be doing something. So I think that we also want to pay attention to that we are such a diverse community, and we have so many different challenges. No matter what the anxiety, no matter what the sadness, no matter that there are ways that we can turn to one another so that we can get through it. It's a tremendous moment in history that we are experiencing.
It is. And we are living it. And it is often difficult to live through the moment. Now, in 20, 30 years, we'll be able to talk about it and how we made it through it. But right now, it is tough living through this moment.
It is.
Any other input from, waiting for another question, but I'm going to add another question. How can we look at people and respond to some of the negative judgments they have on how you may respond? Like we just talked about the guilt you have, but sometimes people can look at you and say, well, you're not doing it right, but you're doing the best way that you can. What's the best response to give them?
Well, you can give them a sarcastic response. You can give them a very kind and loving response. You can give them a Christian, godly, scriptural response. There are many different ways you can handle it, but the main thing is, how are you experiencing yourself? So that, not that I'm doing the best I can, well, I like the way I'm doing it. I think this is great. And if I decide I want to do it differently, I can do it differently. You want to make sure that you own your own work and your own sense of identity and self-worth, and that you separate that from someone else's opinion that may be coming from a place of worry, anxiety, inferiority, competition, whatever. So I think it becomes very important. Again, that's another boundary place where you can set the boundary of, oh, I love the way I'm doing this.
No, I think I'm doing well. Yeah, go ahead, Paula. I'm sorry.
Well, and sometimes when someone's trying to tell you how they think you should be doing it, I will just address that back to them. Is that what's working for you? Tell me about your experience, because that's really what they are coming out of themselves. So I then put the film back on them. Tell me how that's working for you, and that can be very interesting. You know, I'm so glad it's working for you that way, which is another way of saying it's important to recognize that what works for you cannot be universalized to work for everybody else. And it may be the absolute perfect thing for you to do, but that doesn't mean that it applies to everyone else. So I'm so glad that's working for you.
That's a kind response.
Yeah, right.
You know, sometimes when people are giving me unsolicited advice on some things, I just don't say anything. I think I think ignoring it is as powerful as saying something.
Yeah.
It's like, okay.
But you know, one thing, Jill, I wanted to go back and emphasize what you shared in terms of the power of kind of empathic listening. You know, listening to when you were speaking about your daughter and the feelings that she was having. And I do think in the midst of this kind of ongoing stress and trauma, everybody needs to have some trusted person, you know, with whom you can just share how you feel and how you're doing it.
Yes.
And that's not met with any judgment or direction or anything, but just allowing you to express yourself, unload yourself. So you're not just building in and carrying a great deal of stress with you. Everybody needs somebody with whom they can have that kind of conversation.
One of the things too that I have learned in learning to listen is we often feel that when we are listening to people that they are asking for advice.
Right.
And they are not always asking for advice. So I will sometimes ask the question, do you want me to give you advice or do you just want me to listen? And for a lot of people, when you just say that, it gives them a freedom not to have to get a response from you that they did not want.
That's
that
right.
They have the freedom to tell you, and you are just going to hear them. I find that that's a powerful tool for getting people to open up.
Another quick question. We all are under a lot of stress, and we know there are other, friends of ours, Black sisters of ours, who are even under more stress. How do we reach out to them and try to edge them? Let's see if we can get you a little help to get you through this. What can we do?
You have a friend who's going to every protest, to every demonstration, who's not always wearing a mask, who's not always taking gloves. I think it's very important for you to be instructive in terms of, this is serious. Coronavirus is in our community. These are some things that I'm noticing that you're doing. Be aware of it. And I am encouraging you directly to do something differently. It's life and death. A lot of us are in denial. A lot of us don't realize how dangerous things are around us because you can't see it. So I do think sometimes it's important to be directive. And other times I think that we can look at a different approach that one of my colleagues will share with you. Right?
Well, I first want to echo the importance of what you just said, and that it's important to be always available to share with people that the coronavirus crisis is not over, and is really, really there as a constant problem. One of the things as chair of the board at Parkland, on a daily basis, I get detailed information on the number of patients being admitted to Parkland. How many are in the hospital who are COVID positive? How many require ICU attention? How many require ventilator support? The numbers are going up.
Yeah.
You know, the numbers today compared to 10 days ago are up by 25% at our one hospital. Okay. It's so important that we not be lulled into thinking that somehow or another this is over, or we don't have to be as careful as we have been in the past. So I do want to echo that. It's important that we know.
It's
Dr.
life
Paula?
and death. It's life and death.
Yes.
Yeah.
This is Helen, Dr. Paula.
Yes.
I know you just mentioned that you're chair of the Parkland Hospital Board, and I'm not sure what the name of the study is, and I know I'm a little bit off course here, but I understand you guys recently did a study on poverty in Dallas County. Is that something you can speak to for a minute?
Yes, the community health needs assessment is actually required, a study that we are required to do every 3 years. And basically, just in I'm looking across the room, I have a copy of it, but basically what it found was exactly what Dr. Wall and Dr. Jill spoke of. These social determinants of health create tremendous disparities in health care and health quotient within the city of Dallas, and particularly within Dallas County. And that study found that there are 5 zip codes in Dallas County that have such great healthcare disparities that if we were to increase the level of health in just those 5 zip codes, the overall health quotient for the entire county would go up. And, there's no surprise that 3 of them are 752151617, 75210, and I am stumbling on the other one, and I won't dare try to say it because I don't want to say it incorrectly. But basically, it's South Dallas and just West Dallas, and then there's an area that's just north of 635 around Adelia and Skillman. That little area there. And the incidents, the thing that was so striking about it, and the copies are available. If you contact me, I can get it for you, or contact Parkland. But what happened was they showed us a map of the areas with the highest level of diabetes. And then they showed us a map of the highest incidence of heart disease. And then they showed us a map of the food deserts in the area. And I looked over at the staff. I said, wait a minute, you're not advancing the slides.
It's the
and
same
indeed
slide.
They were. It's the same slide over and over and over again. So Parkland is now, we were just beginning the work of specifically targeting interventions in those areas when COVID hit. And we had to reshift, and we're doing some things. But lo and behold, when you start looking at the hot spots of COVID,
the same places.
Yeah. So, but again, as we have said so many times, we are uniquely positioned right now. We have the wonderful opportunity to intervene in some ways that can make a real difference for this entire county. If we can shift just a few things, the entire city will be better. And that impacts all of us. So,
I have one more question from the audience. I know we already touched base about having to set boundaries and whatnot. But what if you don't really have that no pin? Because this is one, I'll read this question. When you are the trusted person that everyone unloads to, I find it hard to find frequent time to recharge. Any thoughts on ways I can set better boundaries when I'm depleted and do not have anything to give to anyone else because I'm trying to recharge?
Yeah, I one of the things that I think that we do sometimes is that we get something ourselves from being the go-to person for everybody. So in some way, it fills a hole for us in some ways.
Yeah.
And so we find it difficult to say no because then we won't be needed by everybody. And that's not a judgment, it's just an observation.
Right.
So one of the things, if you're having difficulty taking care of yourself, you really have to evaluate what it is you are getting from not taking care of yourself. What is it that you feel when everybody comes to you and you are the go-to person?
I think Dr. Paula Donns-Wiggins alluded to that when she said sometimes when we're so busy, when we're so available for others, that it prevents us from really sitting with ourselves and processing some of the issues that we need to address. I work at a church, and because I work at a church, the concept of love is constantly before us. And I think for so many, again, high-functioning African-American women, we are so available to do the loving and to be available for others. And it also implies a bit of control, because if I'm doing the loving and the giving and the being available and even wearing myself out, that says I'm in control. It can be so hard for us to be loved. It can be so hard for us to accept support from others and to even show others, teach others, guide others into, oh, I'm so glad you called because I need somebody to listen to me now. Or I am so glad that you have sent over this food package for the kids. I need one myself. Then you have to guide people in how to love you and how to be available for you. And sometimes it is hard for us to accept the love of a higher power, i.e. God, i.e. Jesus. It is hard to accept that and to remember that we're worthy of love.
Of love. And amen, ashe. I would just add to that too. Again, that's why I really think everybody needs somebody to hold you compassionately accountable for self-care. It doesn't have to be a professional person or a therapist in every circumstance, but there needs to be someone who can look at you and say, I think you're wearing yourself out. I think you need a moment. And someone that you can trust to really hold you accountable for caring for yourself compassionately.
True. Another question from the audience. Understandably, media attention is focused largely on violence and police brutality against Black men and young Black males. And some might say that police brutality against Black females is sometimes marginalized. How do we educate and empower Black women and Black girls to alert them to the very real possibility of police brutality against them without engendering victim mentality or fostering excessive fear within them?
You can look at the work of the wonderful women. Breonna Taylor, who was an essential worker and was so innocently slain. Sandra Bland, no queen left behind. She was a woman who was working very hard in her community, and she leaves behind a family who have carried on the message of this is the work that we do for justice. We do justice work. Etta Collins, anybody remember Etta Collins, who was slain? 70-year-old woman who was slain in her house. Do y'all remember that in the 1980s?
Yes.
Remember that? Okay, somebody does remember that. Yeah. That I think it's important for us to teach ourselves that we too pay a very high price, whether we're mother or whether we're victim. And it's important for us to empower our girls with self-care, with be careful of where you are, do everything you can do, protect yourself, and then look at what the wonderful, brilliant young women are doing on the protest line. They're out there protesting, but they're out there writing and they're out there creating. That we see so many women who are lawyers, who are journalists, who are before us, who are working at home, I love the array of women that we see. And I think if you show them role models, that
Right.
can help them relax into their own genius and their own brilliance and their own confidence.
Okay.
One more question. This, as we all know, are so trying times right now. So here's another question. What are the signs of a meltdown for a child versus an adult during these times?
Wow.
Mm.
Wow. Children can be so interesting because they often don't have the language to verbalize. So children will do lots of things. They may, depending on their age, they may revert back to behaviors that were before, like they may do things like wet beds. They may start to act out in some ways. They may do things like hit other people. They may start to become more isolated, won't come out of their rooms. So you really, really, young people, you have to be just constantly vigilant in trying to know. First of all, you have to know who your child is.
Mm-hmm.
And if you understand what is normal behavior for your child, then you will be able to know what is abnormal behavior for your children. The other thing that I find is if you will allow your children to talk, because as adults, we are always talking to them, and we rarely let them talk to us. So if we let them talk, they will tell us what is going on in the best language that they have available.
I had a great mother who came to see me, Dr. Jill, and she says, I think there's something wrong with this child. He has such rage reactions. I believe there's something wrong with him. She says, my brothers never did anything. And she proceeded to tell me, because when I take him off of that screen and he's playing Fortnite, he just really has a problem.
Wow.
Oh, yes. There are a lot of
Wow.
parents who know about Fortnite. There are a lot of parents who know about the screen time. I said, let me go to an expert and find out just what exactly I should tell you. So I went to an 11-year-old relative of mine and I said, how I feel about Fortnite and these screens. What is it that I should say to the mother? So I think some of the meltdowns that we see may be because boundaries. We haven't set the boundaries and the expectation. This is what will happen. This is what you get to do. These are things you don't get to do. I'm the parent, you're the child.
Yeah. Well, and a lot of times because particularly because, you've been in with your children. And so people who are having to do schooling and they're having to do all of this stuff. And then the activities were gone away and all of that because the parents are overwhelmed, they need a break for themselves. And so some of those things that they may have in the past limited with their children, they are now letting them go at it, play that game. Just give me a minute. And so therefore they are not spending enough time, and children act out when they know you're not paying attention, or sometimes they act out so that you will pay attention.
This is so true. This has been so wonderful, and I wish we could keep on doing this for hours, but I know Ms. Giddings has to say a few words before we wrap this up.
Yeah.
Thank you very, very much, Dr. Donna, and thank you to the fabulous Doctors WWW. You guys have been absolutely fantastic. This has been just something that was so much needed in our community, talking about balancing our mental health, our physical health, even our spiritual in times that we've never seen before. Dr. Donns-Wiggins was talking a little bit about disparities in minority health. And I don't know if any of you saw that on yesterday, I penned an op-ed for the Dallas Morning News regarding coronavirus and the spotlight that it put on minority health disparities. And I certainly wanted to point some things out in that article that, number one, as I know all of you physicians know, and probably others as well, is that frequently we can present with the same symptoms as someone else and get a different treatment. And
Yeah.
I don't know if we have heard about a number of people saying that they had tried to get care at the hospital on several times and were sent home. And some of those same people, unfortunately, ended up with bad outcomes.
Outcomes.
And I certainly wanted to take that opportunity in that op-ed to point out to those who may not know, some things have happened to us in the past, like the Tuskegee syphilis experience, that nobody can actually believe that from 1932 to 1972, people who thought they were being treated were in fact not being treated at all. And so, and I've been speaking to the governor's office as late as today about asking him to put in place a task force or something to really look at these healthcare disparities. And then picking up, I guess, on something that I've heard several of you mention, and that is this moment that we're in. And the fact that we have to seize this moment, this tragic moment. We have to seize this season, which is a brutal season for us. And we have to make absolutely certain that we do everything that we can, because as passionate as people are today, as emotional as we are today, this season and this moment will pass. Protesters will eventually go home, and the spotlight will no longer be on all of these things that we're looking at that need to be corrected. So now is the time, I think, for each one of us to look at ourselves and see what it is we can do. I guess it was Mother Teresa who said, not all of us can do great things, but all of us can do small things with great love. And I think that one of my favorite quotes is, I cannot do everything, but still I can do something. And because I can't do everything, I will not refuse to do that something that we can do. So I think we're being called individually and collectively to do that something that we can do. This, as I said, is the first in our virtual series, Let's Talk. Today, it was Let's Talk Mental Health. Our next session, which I do not have the date for just yet, will be Let's Talk, It's Up to Me. And we will have with us Sent Marshall, who is the CEO of the Dallas Mavericks. And we will have Tashonda Duckett, who is the CEO of the Chase Consumer Bank. And what we really want them to talk to us about is how can we be present in the room? It's one thing to just be in the room. It's another thing to be present. And these are very difficult times for women like those of us who are on this call, who have made it to a certain point, perhaps in our lives and in our careers. And we don't want to do anything that's going to damage our career. And at the same time, if we're not going to bring anything different to the table, why should we be
No need to be at the table.
We don't need to be at the table. So I think
Did we lose her? I think we might have lost her some sort of way, but this has been a wonderful session, and I probably could have gone for hours.
That's something that we can do. And
one quick question before we all sign off. What is the best way of one of our people on the webinar wants to know, what's the best way they can find a mental health professional that's best for them? What should they do first?
There are many resources that are available. I think we have a resource list at Friendship West on our website that'll give you a lot of the doctors that are active in the area. But if you contact any one of us, we will be able to refer you to all of us and anyone else. And then you want to look to see if it's a good fit. You'll know after one meeting more than likely if it feels like a good fit. Insurance, you may look at an insurance list of referrals and then the needs that you have.
Okay. Thank you all so very much. Dr. Walls, Dr. Waggoner, Dr. Paula Donns-Wiggins. This has been a very informative and educational webinar. And as Dr. As Ms. Giddings just stated, we'll be having more in the future. If you want more information, please go to the WLS website. And we look forward to seeing you the next time.